Hi, I'm Rosemary Clay, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading clinicians on important health topics. Today I'm joined by Mike Polello, the Chief Clinical Officer of Substance Abuse Disorder Treatment at Bergen Newbridge Medical Center. Michael is a licensed clinical alcohol and drug counselor and a New Jersey board certified social worker, as well as a long standing member of the New Jersey Division of Mental Health and Addiction Services Professional Advisory Committee and chairperson of the Bergen County Commissioners Local Advisory Committee. Michael is a board approved instructor for the New Jersey Addictions Professional Certification Committee and has provided training for agencies throughout New Jersey since 2006. Today is International Overdose Awareness Day. Today is a stark reminder of the harm that drugs inflict on our society. It is a day to remember those who have fallen victim to overdose, as well as those who have come out and are in recovery. To this day, we wonder whether if the war on drugs has been effective. International Overdose Awareness Day also aims to reduce the stigma attached to the issue, most of which is faced by the families of victims, and remember those who have died without stigma and acknowledge the grief of family and friends left behind. Thank you for joining us today, Michael, on this day. It's kind of solemn, but I think it's a good way of bringing awareness. So on this day of Overdose Awareness Day, can you give us some stats regarding overdoses?
Okay. Well, thank you for having me. While I do not have specific statistics, I can tell you that I know you had mentioned in the introduction the teaching part, and I do enjoy teaching. And what I remember is when I started teaching about addiction, to people getting their certification or license, there was about 50 people a day dying of an overdose. And in 2012, we were maybe at 80, and then it started to skyrocket. And we're currently approaching 300 people per day, many of which is an opioid overdose. 300 people per day dying of a heroin overdose. And the sad part is I often say 300 kids because the population, the demographics have changed so much that these are just, basically 20 something, early 30s. I mean, they're just often kids starting their life, and their intention was not to die obviously from a heroin overdose.
So
But to clar-
how does the overdose occur?
well, I mean, to clarify, really what we're talking about now when I talk about opioids and heroin is really fentanyl, what's mixed into the heroin. And an opioid really just shuts down your organs. I mean, you're experiencing a euphoric effect, which is the reason that people use it. But the more and more you take, the more it suppresses, your organs. And I mean, I'm a physician, but that's basically what happens. Your organs shut down. It's sad. I've never actually been asked to describe that, but that's pretty much exactly what happens.
Hmm. So who's at risk?
Well, that's a great question. I mean, on the one hand, everybody's at risk because there's always been the very common scenarios where I've had cases like this. More than one. You have a 35-year-old man or woman working on Wall Street and they hurt their back. They're prescribed opioids. Never had an addiction problem in the past. Most people that are prescribed opioids, say for back pain, take it as prescribed and then stop taking it. But there is that percentage, and it's a small percentage, but it certainly happens, of people that had no prior addiction, take the opioid, experience the euphoric effect, and they like that feeling. And so they continue to use. So there's a lot of cases like that. So who's most at risk now are really people in your early 20s. Like you hear about, I often hear a statistic that people that start, kids that start using opioids, like Percocet, for example, will use that for a while, and then it becomes hard to get, so they start to use heroin. And the reality is that the period of time that they're using the prescription drugs is very, very brief. I mean, it is so hard to get, and it becomes harder and harder to get a prescription drug. And as it becomes more challenging and more difficult to get these prescription narcotics, it becomes that much easier to buy heroin off the streets. I mean, it's cheaper. It keeps going down in price. With the fentanyl, it's more potent. Again, the potency is something that, would give you more of a euphoric experience, but it also is put you at risk of the overdose.
So you talked about, someone that's taken like a narcotic for pain, right? But is there that small percentage that someone just tries the drug, right? Or, is in a party and wants that euphoric experience and unfortunately overdoses?
I mean, absolutely, that can happen. You could have somebody just at a party that, again, never had an addiction with any other drugs, including alcohol, but suddenly, they're introduced to opioids and, they really like the way it makes them feel. And, I do a lot of measures on self-esteem. So it really is often there's a correlation between, there's something about them, like we'll hear about, oh, the person was like the quarterback on the team, or, the valedictorian, it doesn't matter. It's how they feel about themselves. So a lot of people then will take that, even for the first time, that opioid, experience a euphoric effect, which is a mood altering effect, not mind altering, mood altering, and really puts them in a situation where they just ironically feel better about themselves. And then they're likely to continue. So that could be somebody who's never tried really anything in the past. And just like you said, for the first time. And yes, unfortunately, if for the first time, and this does happen, that opioid has too much fentanyl in it, they could die of an overdose.
So it's fentanyl, just for clarification, for layman's terms, is it fentanyl that causes the overdose, or is it too much of something else?
All right, so it's really too much of an opioid in your system. And so while you can certainly overdose from heroin, the fentanyl is that much more of a risk because it's that much more potent. I don't know exactly, but it's, let's just say 100 times more potent than, say, morphine.
Wow. So what are drugs that someone can overdose from?
Well, what we're dealing with now is calling the opioid epidemic, and
Right.
So it's mostly opioids. I mean, you can overdose from stimulants, for example, like cocaine, crack cocaine. Your heart can beat too fast, and or you could have, say, a minor medical issue with your heart that you aren't even aware of, and you take a stimulant and you wind up having a heart attack. So you pretty much all drugs are a go when it comes to the possibility for overdose. I mean, not necessarily marijuana, that has its own, side effects, but in terms of stimulants and depressants, opioids, there's most street drugs that are sold on the street also carry a risk of overdose.
So how can you prevent somebody from overdosing?
A lot of it is education. Okay, we have to, there's different approaches to that. There's harm reduction. I mean, to me, it starts with education. I remember, somewhat recently, I had a mom in here, and her daughter was admitted to Detox, I think like four times in 1 year. And she was young. She was like, the patient was, I think, like 19, 20 years old. And she had overdosed like 4 times. And the mom was relieved because she always had Narcan. And so, or her daughter was Narcan, so she was brought back to life, which is in effect what Narcan does. But, when I was talking to her, I said, well, that's great. She's lucky because Narcan doesn't always work. And she just broke down in tears. She did not know that. So the education for her is that, yes, Narcan is very, very effective, but it doesn't always work. In fact, it frequently did not work when, in the medical field, we didn't realize that the, fentanyl was increasingly becoming a problem. So the dosage that was given just wasn't enough to reverse that. So they actually doubled the dosage. This is a few years back of Narcan. So we work with the fentanyl. But yeah, there's times you can give the Narcan and the overdose was too great and it does not bring them back to life.
So Narcan, can you explain which drugs it works on, that if somebody's going through an overdosing period?
Well, for Narcan, when we're talking about an overdose, I mean,
Right.
naloxone, naltrexone, and the drugs that's in it can be used in Vivitrol for alcohol and opioids. But for a heroin overdose, yeah, you're specifically talking about Narcan for an opioid overdose. That's what it's used for. So you wouldn't use that for, again, I'm not a physician, but you wouldn't use that for a stimulant or hallucinogen. It would only be used for opioids.
So what if you suspect that one of your loved ones is overdosing at that point? What's the best thing to do for them?
Well, part of the education is, and it's becoming very common, is if you have a loved one who's using heroin, you probably have Narcan around. I mean, the training has been great. The distribution has been much easier to get that. So you would have to, Narcan them. If not, you would call 911 immediately, and they would come with it and do a Narcan reversal. Yeah, but it's a time thing. Like the quicker you give the person Narcan, the better chances that it will work.
So I noticed, and because I work at Bergen Newbridge Medical Center, and I follow a lot of social media, I noticed that there's encouragement of some places that hand out, they're almost like straws to test out your choice of heroin or whatever to see how much fentanyl is in it.
Right.
Is that readily available for people that are using to be safer?
It's becoming more and more available. It's part of harm reduction. So the thinking with harm reduction is, I personally, and really professionally, I promote abstinence, not use in moderation. But if you have somebody and they're just not willing or not ready at this time to stop using, then you have to look at the benefits of the harm reduction approach, which is, give them clean needles, give them the strips to test for morphine, do everything you can to keep them alive. And hopefully with the thinking that at some point they'll be ready to enter treatment and to stop. My only concern with harm reduction is that when I'm meeting someone for the first time, for example, I'll give you an example, Operation Helping Hand, which is just an amazing thing that the Bergen County Prosecutor's Office does. And it started back with Attorney General Greatwall when he was prosecutor in Bergen County. So when he had those 1 week operation, the drug sweeps, if you will, when he arrested, the people that were buying the heroin, he offered them treatment. And often they would take it. I think the first maybe 4 or 5 operations, it was like 48 to 52%. And, we're talking about 40 people getting arrested minimum, were accepting treatment. Now, obviously, these were people that day had no intention of getting treatment. So it really was miraculous to actually offer them treatment and they accepted it. My fear is if I went to them first and with a harm reduction approach, not offering them treatment, but offering them harm reduction, they probably would have chose that first. Because, you're always very ambivalent in the beginning about getting treatment. So you really want to start with, hey, we can get into treatment today. And so that worked a lot. But when that does not work, then harm reduction certainly has its place.
So you talked a little bit about the program. What are some of the resources available here at Bergen Newbridge Medical Center?
Well, Bergen Newbridge Medical Center I've been working in a nonprofit hospital setting for my entire career, which is a long time. And Bergen Newbridge is the first place that I've been here like 10 years now. I was at Hoboken University for 22 years, and nothing, against Hoboken University. I was there a long time. I left on very, very good terms to come here. But the support from administration, the understanding from, top level leaders of the importance of treating addiction is like unparalleled. And the continuum of care, I mean, I've never seen such a thing where we have there's something called the American Society of Addiction Medicine, and they rank levels of care. So there's early intervention, which is like 0.5, and then your highest level, which would be a hospital medical detox. And then there's a lot in between. We actually have every level of care here at Bergen Newbridge. I mean, that's very, very unusual.
So starting with somebody that's coming in that possibly can be going through an overdose crisis, right?
Well, you're
Coming
always
through,
looking for I mean, ethically, you're always looking for the least restrictive environment to achieve the
right,
goal.
right.
So somebody may begin in our intensive outpatient program. We have a very, very large medication-assisted treatment, which I'll talk about separately, but that would be outpatient. So somebody may start outpatient, all right, and hopefully that works. And if it doesn't, then we have the availability to recommend short-term rehab or medical detox. Again, ideally, wherever they start, that's effective. But if it doesn't, we have the opportunity to just move up and down between the levels of care. So some people come in often, of course, they want the rehab. They want to get out of the environment. So they'll come in, they'll get medical detox. And the detox is critical. And again, such a blessing that we have it here, because with the opioid epidemic, as opposed to, like, say, for example, the most recent, say, crack epidemic, with a stimulant, you don't need medical detox. You could go right into treatment. Unfortunately, you could want to get better, but in this current crisis, you need to be detoxed. You will be too sick to just say, I'm going to stop and enter rehab. So it's great. Like, really having that full continuum is very, very unusual and beneficial.
So if you suspect that a loved one is out of control and on the verge of being at risk of overdosing, what avenues do they need to come for treatment? If they needed to come to Bergen Newbridge Medical Center, what's the first access point?
All right, the first access point, that's a great question. And this is, I mean, it's such an important question. It's unbelievable. I mean, because there's mom and dads out there, parents that are just at a point where they're almost accepting that their loved one is going to die because they just won't get better. The best I can do is, we opened up a program called it's Recovery Support Services. We have a recovery center, and what that center is comprised of. So it's not our formal treatment. It's not the continuum of care I was speaking about. What that center is comprised of is people that are in long-term recovery. So people that can literally say to a person coming in, I've been where you're at. And why is that center so important? It's because you could be in your pre-contemplation or contemplating treatment. You're not sure. You don't want to make a commitment. So you can come in. It's a very safe environment. It's like not off-site at the hospital, but away from the treatment end, and just come in and talk to somebody who's been through what that person is currently going through. And so that is very, very helpful in taking that fear away, because it's a very humbling experience to you're going to admit that you need help, and you're scared. If you've never been in treatment, you don't know what to expect. So having that opportunity while you're still trying to decide if you want help, to come into the recovery center, we've only had it for a couple of years now, and it's just been amazing to have that resource. And to your question, it does not have to be the patient. If a family member or a parent wants to come in and just talk, there's no appointment necessary. It's literally a drop-in center. I mean, we do a lot of other things, but for that component, it's a drop-in center. So a parent can just come in, ask to go to the recovery center, and there'll be somebody there waiting to talk to them.
That's amazing. So how do we find more out about the recovery center? It's on the website, newbridgehealth.org.
And literally just updated the brochure yesterday, because like I said, there's a lot of things that the recovery specialists do. For example, if somebody wants to leave treatment, which is common, the recovery specialist may intervene and say, I know how you feel, but if you stick it out, it just sometimes has a different impact coming from somebody that can say, I've been where you're at, versus somebody very, very well trained, and educated in clinical intervention. So really having both opportunities is good. But yeah, it's on the website, or you could dial 201-967-4188, and you'll get Lisa Huss or Christine Klaskins, who coordinates our recovery center, and we'll get you right in.
The 201-967-4188, correct? Perfect. And that's the recovery center, right?
Right.
Awesome.
And then on the website, you'll see what we did with that, which is different than we would do in say that for the treatment end is we actually have the recovery specialists, all their cell phone numbers, everything's on the website. So you could just pick a recovery specialist and call them up like 24 hours a day.
That's amazing. That's an amazing support and resource because, like you said, somebody can just be thinking about it. And just hearing success stories is a huge factor. So recovery center, you talked about the continuum of care, and you talked a tiny bit. You mentioned it about your medicine assisted program. Can you talk to me about that?
So medication assisted treatment. When I first, being somebody that's been in the field for a long time, about 10 years ago, I was probably like everybody else in my position. When you first hear it, you think, we're going to give somebody a medication that's technically an opioid,
Mm-hmm.
so they don't use an opioid. So aren't we just replacing one drug for another? And that was very, very common thinking. One of the things I learned though early in my career is have an open mind. I mean, things are constantly changing. You can't have, you can't just be narrowly focused on one approach. So when the state started to train some of the directors on the importance of MAT, it's going way back, like 10 or more years ago. Many of them just like, it was the first state meeting I ever seen where I seen people just get up and walk out. All right, they just did not want to hear it. The reality is, okay, it's a very different opioid. It's not like you're giving them a different type of heroin. Okay, the euphoric effect is not nearly the same. What it's doing is it's blocking what's called mu receptors that we have in our brain, taking those cravings away. Right? And if you take the cravings to use drugs away, then what we're doing is we're giving people the time to really consider recovery, to go into treatment. Taking those cravings away has just become, like, for some people, like miraculous. All right, so they're taking Suboxone, for example, will be one. There's Vivitrol, there's Suboxone, and there's methadone is actually a medication-assisted treatment, but Suboxone is the most commonly used in MAT. And so we're taking that craving away, and they can continue to live their life without having to go and buy drugs, put themselves at risk of using fentanyl, and I mean the mortality rates. What we talked about, the fatalities are just off the chart. Now we're keeping them alive and giving them the opportunity to work on their treatment without using heroin and still not having those cravings.
So the medical assisted treatment, is that at the beginning of recovery?
It's an adjunct. It goes along with recovery. Like,
okay.
One of the things in the beginning, a lot of times with addiction, you want the quick fix. And, if we had it, we wouldn't be having this in the nowhere road test.
Yeah.
It doesn't really work like that. So, if I could give somebody a pill and that they're cured, that's what we would be doing. It doesn't, you have to go through the work. I'll give you an example. Not everybody has to do it, but for a significant majority of our population, going to Narcotics or Alcoholics Anonymous meetings really, really help them because they're working on themselves. As they get some time, they're helping other people. There's not many places you can go and raise your hand and say, oh, I had an urge to use drugs today. I mean, it's just not. So that's a very safe place. That's just one example. I mean, going to treatment. I mean, recovery is work. I always think if you put half of the work into recovery as you did into getting the drugs, you'll be fine. But it is work. So taking just the medication is not enough. In my opinion. I mean, there may be some people that think just give them the medication-assisted treatment and it works, but that has not been my experience.
So if you're on the medical assisted treatment, you're on the road of recovery. Is there an opportunity to eventually not take the medical assisted treatment?
Yes, it's not something that you're going into with the thinking that you're going to be taking it for life. For everybody, it's different. For some people, maybe a few months. For some people, whatever it takes. I mean, I've heard some of the best physicians, Dr. Anthony Accurso, for example, we have here now, our new medical director. I've heard him say, whatever it takes. It's really true. When they're ready to come off it, then they come off it. If they're in recovery, doing what they need to do, not using illicit narcotics, and still using Suboxone, then fine.
Yeah, agreed. And they're not using what's on the streets, so it's a safe. And I don't want to say it's a safer option, but they are safer.
Yeah,
So
it's a safer option, yes.
yeah. Um, so talk to me a little bit about COVID. How did it affect the person that wanted to get the treatment?
All right, COVID. All right, let me literally thank Deb Visconti up front. All right, so during COVID, everybody like shut down. Literally, every outpatient treatment center in Bergen County shut down. Some of them, and it happened quickly. So some of them had I guess, a good IT department, and they were able to switch, to Zoom and virtual meetings and see people virtually. People with addiction, see them virtually. There's a term that the opposite of addiction is connection, and it is really, really true. I talked about self-esteem and being with people and listening. You're more likely to listen to somebody who's going through what you're going through than if a family member tells you. So this group setting, this feeling of like universality, is critical. So I begged when everybody was shutting down to keep our services open. All right. So, for example, the outpatient, because they were the easiest to close. Really, I mean, there's some places that haven't even gone live, if you will, again. So I remember the reason I thank Deb is going to her, like, I had the speech prepared and why we need to be different than everybody else and keep it open. And she said, Mike, we're a hospital. There's no services we're going to close. So that was relieving, and we stayed open, and patients thanked us to stay open. They had nowhere else. When I say nowhere else to go, it's nothing against other treatment centers. I mean, patients did go to other treatment centers and have virtual sessions, but it's certainly, I think you'll look back statistically and see that people that had a Zoom meeting with their counselor and really didn't have that group experience probably did not have as much success as people, programs that did stay alive.
Wow. So in closing, on this International Overdose Awareness Day, anything that comes to mind that you feel would be an important piece that you'd like to leave our audience with?
Come visit the recovery center if you're considering, treatment. If you want immediate treatment, call the Access Center. All of our substance use disorder, programs are set up for immediate access. And I would also suggest, I did not set this up, but just using this cup, but made me think about it, the Black Poster Project. It's actually, I'll be there at 12 o'clock today. There's in Hackensack, there's something in Bergen County called the Black Poster Project. And when I first got involved, it's done by Alumni in Recovery, and Dee Gillen is actually started. She had lost a son back in 2015, I believe, to an overdose. And she started something called the Black Poster Project, just put a few posters on Facebook, really celebrating the life of the person who had passed away, of their son or their daughter and their loved one. And they had 4 or 5, and other people seen it, and it really took off. And then when I got involved, they had like almost 100 posters. That was only a few years ago. They currently have over 500 posters.
Wow.
Okay? Now, that's not a good thing. I mean, it's just increasing, but it's important. I've noticed it's important for parents to be able to talk about it when they have lost their son or daughter to a drug overdose. Sunday night, I was at a candlelight vigil in like Bergen County, right upstate New York. It's actually right outside Tolman Pool Club, and there was parents there during the vigil, talking about life after losing their loved one, and I mean, it was inspiring because it helps other people that may have loved ones that are using. So yeah, you don't want to go through that alone. But if we're doing, well, I will do everything I can to make sure you never have to go through that.
And I'm sure our audience, as well as myself, I'm speaking for everyone, is thanking you for your dedication and to Bergen Newbridge Medical Center's dedication. So if you'd like to learn more about the Recovery Center, about some of the treatment options that are available here at Bergen Newbridge Medical Center, I encourage you to visit our website at newbridgehealth.org. And remember those that unfortunately were lost on this day of International Overdose Awareness Day.
And I have one last thing.
Yeah.
Only because I talk about barrier-free access and passion for doing what we're doing. And so please put my cell phone number up for anybody who has a question. I'll tell you, it's 201-470-3828. And if you have a question, you have a loved one, it doesn't matter, whatever I can do to help place your loved one into treatment, I will do.
And that's the truth. I've attested to it. I've seen it. So thank you for your dedication, Michael, to Bergen County and throughout New Jersey. And thank you, everyone, for joining us today. And I look forward to our next in the Know It Row. Thank you again.
Thank you, Rosemary.
Take care.